Good day, Wonder Nurses. I'm Nurse Anne. Our video for today focuses on different exam questions in psychiatric care. This video will help you how to answer various questions about therapeutic communication. I'll give the answer and rationale after each question. You also have 30 seconds to answer. If you're ready, let's start. Question number 1. The correct answer is letter D. The patient needs to learn how to communicate directly with his wife about her behavior. The nurse's assistance will enable him to practice a new skill and will communicate the nurse's confidence in his ability to confront the situation directly. Options B and C inappropriately direct attention away from the patient and toward his wife, who isn't present. Option A implies that there might be a legitimate reason for the nurse to assume responsibility for something that rightfully belongs to the patient. Instead of focusing on his problems, he will waste time convincing the nurse why she should do his work. Question number 2. The correct answer is letter C. This provides support, reassurance, and an opportunity to gain insight into the cause of the patient's anxiety. Option D dismisses the patient's feelings and offers false reassurance. Options A and B don't allow the patient to discuss his feelings, which he must do to understand and resolve the cause of his anxiety. Question number 3. The correct answer is letter A. Clinicians generally consider 6 to 8 people to be the ideal number of patients for a therapeutic group. The size allows opportunities for maximum therapeutic exchange and participation. In groups of 5 or fewer, participation commonly is inhibited by self-consciousness and insecurity. In groups larger than 8, participation and exchange among certain members may be lost. Question number 4. The correct answer is letter B. Inquiring about the patient's way of life allows for further exploration of the message he's trying to convey. Option C doesn't permit maximal exploration of the patient's experience. Option D is incorrect because the patient could misinterpret it as a challenge and become even more defensive. Option A is also incorrect because the nurse shouldn't identify the patient's feelings for him. Question number 5. The correct answer is letter B. Although all of the options are desirable, knowledge of self is the basis for building a strong therapeutic nurse-patient relationship. Being aware of and understanding personal feelings and behavior is a prerequisite for understanding and helping patients. Question number 6. The correct answer is letter D. This response allows the nurse to provide feedback without making the patient responsible for the nurse's reaction. Option A is accusatory and blocks communication. Option B is a challenging remark that can lead to power struggles, lowers the patient's self-esteem, and blocks opportunities for open communication. Avoid why questions such as the one in option C because these questions put the patient on the defensive. Question number 7. The correct answer is letter A. This response answers the question honestly and non-judgmentally and helps to preserve the patient's self-esteem. Option B is an open and candid response but diminishes the patient's self-esteem. Option C doesn't answer the patient's question and isn't helpful, while option D would increase the patient's anxiety because her inability to walk is directly related to an unconscious psychological conflict that hasn't yet been resolved. Question number 8. The correct answer is letter C. The therapeutic nurse-patient relationship consists of three overlapping phases: the orientation, the working, and the termination. During the working phase, the nurse and the patient together evaluate and refine goals established during the orientation phase. In addition, major therapeutic work takes place, and insight is integrated into a plan of action. The orientation phase involves assessing the patient, formulating a contract, exploring feelings, and establishing expectations about the relationship. During the termination phase, the nurse prepares the patient for separation and explores feelings about the end of the relationship.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.